Welcome to Healthcare Today YouTube channel. We know that currently the diabetes and its related complications become a burden for the whole society and healthcare system. At present, in India, there are about 77 million population who are affected with diabetes. And when someone get affected with diabetes, they slowly develops so many other conditions in their body due to the diabetes, and their health cost becomes so high. It is very well known that a diabetic patient who is diabetic, if he remains or she remains diabetic for a longer time, he develops complication of his kidney, his eye, and his heart. But do we really know what happens to their foot? Probably this is a very less aware area among the diabetic population, not only the diabetic population, but also the physicians like us who are treating our diabetic patients. If we consider all the complications related to diabetics, then the foot complications, they are 1/3 of the total complications. And the foot complication usually the diabetic foot. We have seen diabetic patients who are long-term diabetic, they develop some infection in their foot, very small infection. And within very few days, that infection becomes very fulminant and the whole leg need to amputate it. They are so devastating. Why a patient's foot need to be amputated? Cannot be prevented. So if we see how this diabetic foot can be managed, if we have the idea, then definitely we can prevent all these unexpected amputation or death due to the diabetic foot infection. What is the reason for developing diabetic foot infection? So in diabetes, like any other body complications, the nervous system also get affected and the nerve gets dried up. It's a neuropathy, diabetic neuropathy. And due to the effect of this diabetic neuropathy, the sensation of the foot, they get diminished. When the sensation get diminished, it becomes very difficult for the persons affected to the diabetes to recognize any kind of injury or tactile sensations of the foot while walking or any other activity during the day. That means in an insensate foot, there can be injury. Injury can be happen from the tight footwears, can happen due to the walking barefooted and something poke in the sole, any metal or any thorn or anything, or even a stone. Though the foot is insensate, this kind of injury, people do not recognize that they had suffered with the injury, and they continue walking with the same injured limb, and slowly that injured area get infected. And in diabetes, infection usually get fulminant and spreads very rapidly. And due to that results, the infection cannot be controlled and the limb may need to amputate, or sometimes patient goes into severe illness and may die due to the complication of that infection. So the main cause of these injuries are due to insensate foot. And most of this neuropathy that happens due to diabetes, they are not symptomatic. That means when they are developing, patient does not experience any kind of symptom of the neuropathy. Nearly 90% of the diabetic neuropathy, they don't produce any symptom. That's why they continue living with the neuropathy, and they can realize when the neuropathy is very severe, that means the foot is totally insensate. Only then they can recognize that they have some problem. But then it is too late to take any action to help them. That's why there's a recommendation developed to prevent this kind of complications. So we need to check every diabetic patients every year, so that we can identify anyone who is developing neuropathy. That is very early stage when there is no symptomatic. If you can identify those people, we can warn them, we can educate them, we can create awareness among them, and we can teach them how to take care of their food, how to take care of the health of their food, and personal care. In the same times, we can alter the treatment of the patient to prevent the progression of the neuropathy. We can change the footwears, a lot of things we can change in the life, and we can prevent or reduce the possibility of developing diabetic foot infection. If you can do this, then this kind of catastrophe can be reduced. Because if a diabetic foot infection happens, whatever treatment you give, the end result is not satisfactory. The cost of the treatment is very high, but the satisfaction is very low because of the ending with any amputation or other foot deformities. So, to prevent this kind of diabetic foot infection related complication, we need to create awareness among the physicians and the diabetic patients, to everyone, so that they get their yearly checkup for diabetic foot and detect that any risk factors very early, and they can be prevented from this devastating complication. We care about it.